And tonight we have two presenters that we are thankful for coming out and giving their time to this educational forum. Our first speaker is Tanweer Kaleemullah. If I say that right. He is a public health analyst at the Harris County Public Health. He works in the Office of Policy and Planning, where his main goals are to improve and increase the linkages and relationships between healthcare and public health to advance population health. We're thankful for Tanweer's time this evening, and without further ado.
Can you hear me? I mumble sometimes. So, and also Ramadan's coming, so I haven't had my coffee. I was trying to wean myself off coffee, but I forgot it was my afternoon coffee. So if I start getting a headache or mumbling, it's because of that. All right. Before we start, just to get an understanding of who's in the room. So how many students are there? Raise your hand. Okay. How many people on the clinical side? How many community organizations? Who works at a hospital and also works for a faith-based organization? All right, so this presentation, this discussion, sometimes my words may seem like I'm directed towards physicians, but it's actually for physicians and for nurses and community organizations and everybody. So whether if you're actually somebody who should be implementing this, I hope you get something from this, and please feel free to push back whatever I'm saying. But if you're people who are engaging people in the healthcare sector in your facility, hopefully you get something from this that may be some help in your discussions and trying to encourage increasing social determinants of health work in all different ways. What does this have to do with me? What does this have to do with me? So typically, starting off, and how many of this, I know since you came prior to this, how many of you have heard of social determinants of health? Is there people who have, which is totally so typically you have a patient goes to a clinic or a hospital, and they see the physician or practitioner or some of the mid-level provider. And so let's say the issue is chronic asthma. So that person happens to have upper respiratory issues, and because of asthma and their allergies. And then typically what happens is you provide some prescription for medication and so on and so forth, and that's about it. And that's not just about it, but there's other things that go on. But then, because of the social worker or some other circumstance, you come to find out that also the person is inactive, which may have gotten from the employment or not. Then you also find out, well, the reason why they keep coming back is because there's mold in the walls. On top of that, they also have rodent infestation. And on top of that, those people have also gone to the landlord and said, hey, can you fix this? And they said no. And if you look like evicted, you'll see like less people can't say anything because they can get kicked out of their apartment and they will have nowhere to go. So that is kind of like if you're going back, whereas this is where most of the whether you're a practice or a hospital clinic, this is where you're seeing it at. This is where we're trying to get you to understand there are other aspects that are kind of going beyond that. The next case is the non-compliant patient, which is very frustrating. I have my mom, she has a lot of issues, and she's awful about falling through on her medication. She stopped after 2 days and says, it's not working. So there are those types of cases as well. In this case, let's say you have a diabetic, and they have poor eating habits, and they don't exercise. That's very typical. And then the physician or practitioner or physician assistant says, all right, eat better. Assuming you are well-versed in nutrition, so hopefully you are, I'm assuming you are. Eat better, exercise, maybe something, and just some medication, so which is great. But then, come to find out, after 1 month, the person has not really done anything. They haven't taken their meds, they haven't exercised, you're diabetic, and you're like, oh my gosh, this is so frustrating. This you find out from a phone call, maybe your social worker may have followed up. Can you hear me?
No.
You can or you cannot?
Not really.
Okay. I'm going to see. Can you hear me now?
No, it's not on.
Actually, I'll come out here that we're a little more.
Yes.
So if I turn my back to you, I apologize. Not meant to. Okay. So, but then you find out that okay, so the person doesn't have transportation, which the person actually she really wanted to get to the appointment, but she could not get to the appointment. And on top of that, money issues. So she didn't have transportation. She didn't have the money to get to the appointment. That's not even including if she was being referred to a different appointment, to a different specialist, or maybe to a behavioral health issue. Maybe she has depression, and the physician was like, you know what, maybe you need to go see a therapist or something. And the money also plays in because she has a child, and child care. On top of it, she also works multiple jobs. So it's because she can't exercise because she has no time, and she can't really get to her medicines because she can't get to the pharmacy. So these are all the issues that we're wanting to, are kind of what we're calling the upstream issues of social determinants of health that also affect the health, and because, meaning that she's not compliant medication. So that's meaning that's what's on the outside, but there's the backstory that maybe you don't get to see. So this is our Harris County Public Health definition, but the WHO has their own definition of them. Basically, health happens where you live, learn, work, or play. And so that, as you can see in the previous two slides, you can see definitely how the rest of life actually affects. And when I first started working where I was at, there was a physician panel, and I butchered this, but basically the thing that got me was, and I was like, okay, I got it. So let's say you have an overweight mom, and she goes to the physician, and he says, all right, stop eating donuts and direct driving. But then you come to find out that, you know what, she's got a kid who's suicidal, and she's depressed, she's divorced, she's about to leave her house. So that advice really is not going to do you much help. It's good advice, but it does not address the root causes or the upstream issues that are going on with that. And understand that this can apply to, I'm an idiot, so I understand what it means to be a physician. But that was my joke, yeah. But this applies to nurses, to assistants and staff. You are trained for a specific role. You've gone through so many years of school saying, this is not my arena. I don't know what to do with all this kind of stuff. They're living in an apartment. I'm not a lawyer or anything like that, which we do understand. Just make sure I'm not forgetting. If you're thinking about health for your patient, you're trying to get to, I've worked with hundreds of physicians and nurses and several other clinicians and staff. The vast majority of people I've worked with are very sincere about wanting to help their patient. And the thing is, you're helping your patient, but you're not, without being able to finally get to the underlying issues, there's only so much you can do. And this presentation is going to discuss what are things that you can hopefully do within your capacity. And that's the thing. We're not trying to get you to stretch beyond where you're at, but we're trying to get you to go beyond where you are at right now because there's much more that needs to be done. So I'll make that make sense. So back in the term social determinants of health actually came into existence before, but in America actually hit really around 2010. So we're a little bit behind some things sometimes. It started taking off, and it's still actually relatively young. I mean, I started at the county around 2015. It just actually was in a short period of time, a lot of things have occurred. But one of the things I wanted to point out is this is not meaning that healthcare physicians and nurses and assistants and staff are supposed to be taking the brunt of everything. This is a community effort. But you have, within your zone of control, a lot of things that you can do. That's where we want you to focus your efforts and energy at. We have the handouts so you can see, but basically you can see up to about 80% of a person's health is affected by things outside of the clinic. I had a physician at a conference saying, well, I think I picked the wrong field because 80% of things happens outside. And I'm like, no, that's not the point. I have children, I have a wife, we have people who are diabetic, who have broken arms, who have all this. So do what you're doing is so important. So it doesn't mean it's just the proportion of what affects a person's health is not, that's where the proportion is. What you're doing is vital, but you have to understand that there are a lot of other things that are affecting the health of your patients outside of your realm. And the more you can kind of travel into those areas, the better it is going to be for your patient. This is just some statistics. I think most of you all know about this. So in Houston, basically, I think it's about a fifth to a quarter of all, I think think if you look at the statistics from the screening, basically about a quarter to a fifth, or a quarter of the patients actually have food insecurity. And that can be malnutrition, it can be not having access. And that actually also, the number is not just going to be in poor areas. You're going to see even affluent clinics are going to be having, based on some of the clinics screenings that I've seen, you can get 7 to 11%. Even in affluent areas, you're going to be having food insecurity. I mean, imagine in our own city, we have people who are having cans of soup and trying to water down so they can eat over a course of like 3 days, which is just mind-boggling to see with all this food. Speaking of, Nancy actually invited an organization called Second Serving. So if you don't know about them, look them up. They actually work with a lot of wasted food, which is actually another side of the story too. Housing security, these are just some of the issues. In Houston alone, Houston and Harris County alone, there's 27 to 40,000 families on a wait list for housing. And that list is frozen, so that means there's so many more. And housing issues deal with gentrification, homelessness, and a whole host of other things. That's not including, like, if you have a house, you're having to make decisions on where you're going to be spending your money. So a lot of times the healthcare is not where you're going to be spending your money. Transportation, just really quickly, it means access to a lot of these various places that we're talking about. It also means where you are in relation to maybe like highways and roads, where you're not, and also how those environmental issues affect your health as well. These slides, I think, can we send these out? Because there's a lot of small writing, but I just wanted to kind of point out that education and employment have a huge amount of effect on your health. And I think that's the main thing, is like all these issues, all these different upstream issues have so much effect on your health, on the health of your patients, that are outside of the realm of your understanding, and not outside of your understanding, but outside of kind of where you're thinking about when the patient's like right in front of you. It's kind of difficult to be thinking about this type of thing, unless you're maybe working like this school-based clinic or something. ACEs, which is one of Nancy's area, that's sort of her expertise there, is adverse childhood experiences. I kind of see these things as almost like synonyms in a way, because they go hand in hand. But these are all the various issues that affect a child from a young age that has long-term effects on their health. So right now, healthcare is, this is generalized. So you have episodic care and disease management. And what we're trying to do is see what can we do to get up to address the social determinants of health. So how can we do that? So one of the first things you would want to do is try to learn what's going on. So at Harris County Public Health, what we decided to do is we decided to, and at your table, you're going to see this is the executive summary. If you go online, I think they also sent out a link to that before you want to look at that. But what this was is this gave you, and this is actually a couple years old, it gave you a landscape understanding of what is actually going on. And the hopeful thing is there's a lot going on in our own community, a lot of hospitals, a lot of clinics, a lot of community organizations are doing a lot of things. So the report is actually just understanding. We interviewed over 100 people across the sector, across various organizations, again, understanding what was going on. But I do recommend, the thing is, like, one of the things that is stunting is you don't know what's going on, so you don't know where to plug in. So that report, and actually there's several reports, Dr. Change, I'm sure in their forum, Texas Children's, and there's a food insecurity report. There's several other reports out there. The more you know about what's going on, so my suggestion is to make sure you're reading. As you're reading your different various journals and articles, make sure you're reading these types of things. The more you know, or plugging or attending these types of events, the more you can see what's going on. This is where actually I fit. This is where I can do it. Some people might have specific areas that they're going to be caring more about. Some people may care about partner violence. Some people may care more about the housing issue. Find where your area is, and start kind of making sure you're plugging into those. The more passionate you are, the more you're going to be doing those things. All right, so within the clinic and hospital, you have two different sides in a general sense. You have the business clinical side, and you also have the community benefit side. The community benefit side is like the one that usually is the one that you look to when they're doing community collaborations. And so this is, as anybody, if you're working in a hospital or clinic, whether you're clinical or non-clinical, this is one way you actually can engage the social determinants of health. You can work in a community collaboration. You can work in advocacy. So, for example, in your neighborhood or in your city, there are housing policies. So, it is good to advance your, there are dilapidated neighborhoods, but what happens is you have gentrification that occurs, or then you have people who've been there for decades have to move out because they move out, but there's ways to retain housing for low-income people. So you can get involved with that. You can get involved within your own facility, trying to get rid of sweet drinks, like sugar sweet drinks, those types of things, if that's already occurring. You can help trying to, is anybody here a community health worker? Social worker? So there is a lot of social workers of all different types, and community health workers, I would say, are very key to a lot of this work, because they're the link between the community and your facility. And at this point, a problem is there's not as much reimbursement to fund a lot of those issues to help you do a lot of this work, to help facilitate your work. And so that is something at the state level. At the federal level, you or somebody you can help advocate for reimbursement. Because the more people, the thing is, we can go up, Texas Children's go up and say, hey, this is what we need to do. But if you get a crowd of people going up, that's where the power is. Especially if you're a physician, you're a nurse, you're representing a hospital, you're a clinic. That is where a lot of the power is going to be. These are examples, actually, of some community collaborations that are going on in your area. So this is a little bit of a cheat sheet. So Healthy Living Matters is at Harris County Public Health. Near North Side is near North Side. That is actually a very comprehensive initiative. Integrated care initiative. I just wanted to spend a little bit of time on them. Integrated care is actually so key. So we're talking about social determinants of health, but behavioral health is so intertwined with all this. You should be seeing a lot of times behavioral health and physical health are almost seen as two different bifurcated areas. And it needs to be seen as under one banner of health, because obesity is affected and affects depression and stress. If your neighborhood safety, which affects obesity, is caused by, ends up inflicting or because of depression. So these are a lot of things that there's a lot of work going on. Mental Health of America is spearheading a lot of that work. And so they're doing a lot of policy work. They're also working on the education piece and the finance piece. I'm trying to see, what are the best ways to co-locate behavioral health and physical health providers, as well as cross-training. So this is actually a really key piece. If you're not already involved with this is another area I would suggest you really try to inject yourself into. Because it's still at the, I think, developmental stage, but it's still something that needs to be pushed on a little bit. So that's the community side. But the other side is the business clinical side, which is more difficult because a lot of the issues are bottom line driven reimbursement dependent on, and that's the part that's more difficult. So, but one of the easiest ways, if you are a physician or nurse, staff member, to actually see where you can actually interact with social determinants of health is through social determinants of health clinical screening. So this is one of the collaborative health living matters at our shop, and we have a healthcare sector group. So what we did basically, as you can see, on the left side are all the partners that participated in a group that we convened, and a lot of the partners from here, actually a lot of the people in the room that played a really active part. So these are all examples of a lot of the screening that are going on in this area. So again, this is some, I think, the PowerPoint you'll be able to see later. But if you see Memorial Hermann, Texas Children's, UT Medical School, there's a region-wide initiative, food insecurity initiative, which is actually actively trying to embed in medical records food insecurity screening, as well as at some point also getting de-identified data to actually map that out to see what's going on, and that's paired with chronic issues. That's something that's in the works right now. So the first part is already pretty much mostly done, but that's a big area-wide initiative. And if you look at the CMS Accountable Health Communities, that's actually part of one of the most important ones, because that's from CMS. So what they're trying to do is see if it's cost-effective to actually screen for social issues at the clinical setting. And that's a 5-year grant. So we have Memorial Hermann, you have Texas Children's, you have Harris Health, UT School Public Health. UT School Public Health is actually going to spearhead the Bridge organization leading this, and Gateway to Care. So this is a big region-wide initiative where they're going to have to screen 75,000 patients a year. So at the end of the 5 years, there were 32 sites across the nation. Houston was one of the sites. Texas got 3 of the sites, which was great, surprisingly so. So there are a lot of things going on in this area. So one thing good to say is there are things that are going on. Another way of looking at it is these are things that whether you're in it or not, it's coming your way. So you need to be ready for it. And as we're moving towards value-based payments, there's nothing in the value-based indicators or the criteria that says social determinants of health. There are more proxies, but it doesn't mean later on down the road what you're going to be getting your reimbursements on are going to be related to these outcomes that are going on upstream. So if somebody's living in a poor house and they're not taking their medication, that's going to reflect on your payment. So if you're more interested on the economic side, that's something to be aware of as well. And there's other things, other issues. So basically, just quick comment. Okay. Basically, what we did was over the course of a year, a lot of the several of the organizations that were on the previous slide about the screening, they convened, we discussed things, we went through a lot of case studies. What we try to do is create a unified but not uniform set of goals and advice. Because every institution is different. There's no reason to make a cookie cutter. Texas Children's has their interest, Moral Herman has their interest, CHI St. Luke's has their interest, Methodist has their interest. But there are some things that we can do together. And before we get into our silos, we thought this was a great time to make sure we're kind of thinking along the same lines. So what we did is we created a guide to help hopefully answer a lot of questions that you may have. It's not going to answer every single question, but it's going to hopefully answer a lot of the questions that were, you can see that were outstanding, always there whenever we discussed it, that came up with discussions. Also, there's advice in there. So advice as far as like this one is, how do I know which to screen for? So there's advice. So what we wanted to do is think about, well, this is supposed to be for multi-million-dollar hospital system as well as a single practice physician. So we were like, well, how can this person, so what we did is these are some of the questions that we addressed. So one of the big questions is, what do I do if they say yes? That's the big word. So how many people have thought about that already? So what do you do say yes? So actually, you're screening. You're not trying to solve it. So it's screening. A lot of the times, all you have to do is just say, look, you can refer them to your social worker. You can print out, hey, look, this is the phone number of your food pantry if they have a food insecurity issue. But a lot of things you can do that are totally within the thing. And the thing is, your institution and your practice need to customize what works best for your practice. Nobody's telling you to do everything all at once. But you do what you can do. But within the scope, there are things you can do that's totally legal and you don't have to worry about the liability. And the resources, there are other resources if you look at the pack, and gives you advice of where you can go to. And there's more resources that are coming along the way as well. So what we did is we looked at the screening tools. There are existing screening tools that are going on, that probably like 30 across the country. But there are about 4 or 5 that are being used in the local area. And so we decided to just look at the ones that are being used. CMS account will help you use one that came on later, but it's so new. We thought, well, we don't know how far that's going to go. So we ended up recommending the Prepare tools. Not perfect, but there are many things that it has a lot of momentum behind it. Even at the federal level, it has a lot of support. So that's the reason why we did that. It also has. What we did is came up with a list of core measures. Like if you're trying to say, well, what can we do? What should I be screening for? So on the list, the group decided they ranked all the different social determinants, and they said, if I was going to start, and I can only do one, food insecurity is one that I'm going to actually start off with. And the second was housing. So housing actually is interesting, it's the hardest to impact, but that was what the group said, that's so important to health. That's what we wanted to actually work on. And this also, how can I fit this into practice? This, I just give credit, this was actually created by Doctors for Change, this graphic. They did a wonderful job with this, so this isn't in the, I want to give you credit. But just to show you, even if you find out there's something going on, you're again supposed to stay within the scope of what you're doing. So if you find out there's a food issue, if you find out there's a housing issue, there's partner violence issue, refer them to your social worker. We're not expecting the physician or nurse to solve that problem, but we're trying to get you to understand what are the other underlying issues with that person's health. And what else can you do to transform your organization? A lot of different things. These are just some examples. You can be an advocate for trying to bring in a grocery store into your house. You can try to help create a medical legal partnership. In Houston, there's already 3 medical legal partnerships, which is basically a formal relationship between a clinical institution and a legal entity to help address those issues with the landlord that is not taking care of what they need to. You can actually have your legal partner actually go after them, which has occurred. Or if you have children in school that are having educational issues, they can address those issues as well, which ends up affecting depression and mental health. There are a lot of hospitals that are hiring people who are more well-rounded. So a lot of institutions are actually hiring population health executives. You can also make sure when you're hiring people, there are people who are more geared towards this. If you have a person on the floor who doesn't understand these issues, and when they're talking to the patient and they're being a little more rough with the patient and not being as understanding, that's going to affect the patient's outcome. It's going to affect the outcome of the patients. So you need to make sure that the training is occurring in the facility, as well as trying to get those people who have an understanding of what's going on. Or you can create an organization. So I know much time people know Dr. David Buck. He created PCIC. I don't remember what the acronym means, but it's a multi-sector organization. He's a primary care physician who works with Baylor. I think he teaches there as well. But they work with the super utilizers. So basically, that's the population. I think it's about 1% of the population that takes up about 22% of the resources in the community. So that he's addressing that at a very data-centric level. Just be a champion. So what can you do? Just whatever you're comfortable doing. Plus just a little bit extra. And the reason I put this slide in is actually the TMC Policy Institute had a 13-week course on policy. And so there was a medical student, not in this room, who wasn't speaking for himself, but speaking for his classmates, saying they were feeling overwhelmed with all the social terms of discussion. And I was like, don't worry about it. Again, just do what you can do. I mean, there's going to be primary care physicians, obviously, you really need to be looking at this. Specialists, especially cardiologists, and endocrinologists, you need to be looking at these types of things. Plastic surgeons, you're going to have people who may be coming to you because they have depression issues or other these types of issues. You need to kind of, main thing is if you can just key yourself a little bit to understanding what is going on with your patient, it's important. But just do what you can do with the scope. And then, if that's it. There's going to be people who are more motivated. I know there are physicians who may be in this room, but Dr. Kaleemullah is like all over the place. I think she works with Dr. Change. She's not in here. Oh, there you are. Oh, I'm sorry. I was going to use Dr. Greeley if you weren't here. So, but she is all over the place. So, but she's an example of somebody who, sorry not to embarrass you, but you're here, sorry, who does a lot. But that's within the scope of her abilities, and she has unlimited stamina. So, that's great. There's some people who are like, you know what? It's like I'm in it for the economics. I care about the patient, which is totally fine. But also understand the economic side to it as well. So, anyway, so that's just the ending message. There is something to be done. There are a lot of organizations. The thing is, there are a lot of things to push back against doing this, but there are a lot of organizations, physicians and nurses that are doing this across the country. So you really don't have an excuse to say you can't do it, that it can't be done. It's being done. So just understand that. And if you have questions, if you want to push back, feel free in the Q&A session. So that's it.